Scientifically speaking.
Do it again. Once more. One last time. Do it again or else they won't be safe. Once more. Again, just in case. No, that doesn't feel right. Do it again. Have you ever had those recurring thoughts in your brain? The ones which make you repeatedly do things to keep someone else happy or safe. You might do something to make those certain thoughts go away. Has that ever happened to you? Well, if it has, there might be a chance you've got OCD. We'll be discussing the actual symptoms of OCD later, but first we should ask the most important question right now. What is OCD? Well, OCD, or Obsessive Compulsive Disorder, is a disorder where people continually have bad or unwanted thoughts, obsessions, which lead them to repeatedly do something, compulsions. They might wash their hands, flick a light switch, clean something a certain amount of times to try to make their obsessions/bad thoughts go away. People without OCD might also have these bad thoughts, but it's easier for them to let go of these thoughts rather than when people with OCD have them. Some causes of OCD are genetics, one's genes, the environment in which a person lives in, or any brain abnormalities. OCD can also sometimes run in the family. These causes aren't 100%, but some experts believe in them. As I mentioned earlier, I'll be discussing the actual symptoms of OCD later. Well, now is later. Another thing which I mentioned earlier is that OCD is obsessions which lead to compulsions. Well, some common obsessions which people with OCD face are repeated doubts, thoughts of violence/hurting others, spending time touching things, putting things in a specific order, disliking germs/dirt, and thoughts that you will lose or hurt a close person/family member. These obsessions lead to compulsions such as repeatedly hand washing, checking things repeatedly to make sure they're turned off or on, following rules about colors or numbers or letters or more. All this compulsion/compulsive behavior may feel like some kind of ritual which is necessary to do. Now, before we continue onwards to the statistic of OCD occurring in a group of people, I believe we should talk about how far back OCD dates to. OCD, or a type of it, has dated back all the way to the 1400s. Back then, cases which appeared were known as scrupulosity, OCD, but doing things related to one's religion. Back then, religion was one of the most prominent features of life, but soon onwards, other signs of OCD in people were being noticed. Physicians in 1700s to 1800s described that there were people excessively washing their hands, checking things, and having violent thoughts which they disliked. Less religious-related obsessions were being noticed compared to before. Slowly, OCD's day was beginning to develop, and soon enough it was actually known as a disorder. Now, let's move on to the statistics of OCD occurring in a group of people. Just for a heads up, some of this data is outdated since OCD statistics aren't taken quite that often. But here we go! 2.3% of the population, or 1 in 40 adults and 1 in 100 children, suffer with OCD in the US, according to Anxiety and Depression Association of America. But, according to data from Stanford taken in 1992, 2/3 of people with OCD have dealt with major symptoms before the age of 25. This shows that perhaps the amount of children dealing with OCD has decreased since the 90s. Also, according to a book, American Journal of Medical Genetics, published in 2005, there's a 25% chance that an immediate family member will develop symptoms of OCD if that family has a history of OCD. Now, to end on a good note, the final thing we'll be discussing in this episode is the treatments of OCD. For your information, I will speak in second person to make it easier to understand how hard it truly is for people with OCD to get rid of or lessen its effect. Depending on your age, past medical history, and more, doctors will recommend different things. But most of the time, cognitive behavioral therapy helps as well as antidepressant or anti-anxiety medicines, depending on your age, of course. One thing which helps is to slowly try to fight the OCD, not always follow your rigid rules/rituals. But, of course, do it slowly, because if you rush in, you'll probably just leave yourself more in pain. It may take a while to try to calm down or push these thoughts/rituals out of your brain and daily life. It is also very hard. Remember to relax, and if you'd like to do meditation or yoga, remember, always stay positive. And with that note, I'll end today's episode. Thank you for listening, and I hope you enjoyed. Bye!
Sciencely speaking.